wraparound services. We have to make sure that they're in safer conditions and make sure they're taken care of and making sure that the partners stay connected to all of those services and delivery of the model. We also need dedicated outreach for encampments. So on top of everything that we're already currently doing, we are also today adding on additional 3 outreach workers for our office at OHSS so that we can help with this work moving forward. We don't want this to be a one-off. We want this to be a continued model. And the Flex Fund was the difference maker. Unity's team was excellent in engaging with landlords and bringing a lot of this access to the market that didn't exist before, and also looking into new landlords that didn't work with us before. And we need to continue these efforts and bring it on a Flex Fund. We are currently at 655. We want to get up to that 2 million point so that we can continue this effort and moving everything in the right direction. This is the site number 2, the Tremette. Currently, we have 77 regular stairs at the vicinity, 34 already housed, and lots of tension structures and stuff have already started taking place and being cleaned up. Lots of movement happening within that 2-block radius, and we will continue doing the maintenance on this location. So 5 weeks from January 10th up to February 9th. 7 closed maintenance partners, as you can see, all of the partnerships that are there. And still, we have our 5 outreach staff for Unity and Travelers Aid, 4 housing locators between Unity and OHSS, and 5 case managers with Travelers Aid doing this work and doing amazing work at it. If you've gone past there lately, you see a dramatic change in what the encampment used to look to where it currently is. And just to let you know, once again, like we said before, although, you know, outreach to housing is one of our processes, we also working on shelter into housing and what that process will look like. So we have a kind of a drawn out timeline on what it could look like moving forward. So you can see what the initial plan could look like in the future and how we can get to some progressive steps in that process and moving beyond. But just to give you an idea, like if we stayed on the mark of where we're currently moving, this is what the intended outcomes could look like. What's next? Initiative dashboard, where you can actually see what is happening, timelines. You can also look into different ways that United Way is helping us. They were doing a website. It's going to be amazing. Developing that tracker is going to be amazing. And just giving us a level of transparency that we currently need as a community so people can understand how we are proceeding forward and what's already taking place. HUD contract, nearly 15 million being executed, has been executed, creating 420 housing packages, and providers will be hiring staff and accepting referrals to continue that great work that's already started.
Those housing packages is that with Habitat for Humanity that you're working with?
For the housing packages that we've been actually purchasing those housing packages. I don't think that we have been doing the Habitat route just yet.
Okay.
They are still partners of ours.
Okay, good. I just wanted to make sure that they're still engaged.
Yeah, they're still ready to go if we need.
Mr. Fields, could you explain to the public the package again, what's encompassed in the package?
Absolutely. So the housing package includes dishware, food preparation kits, blanket sheets, a blow-up mattress when they initially move in, which will eventually, we have ordered furniture for them to move in, so they'll have a bed, dresser, and an end table.
Did everyone who was relocated, were they offered a package?
Yes.
Right. So it's not just an apartment, but you're providing, in a way, some of the essentials that people need when they get into the apartment.
Absolutely. And with the continued case manager, if that person needs assistance with groceries, foods, or any other things that they're dealing with, they can still get those assistance through the case management.
I'm trying not to be antagonistic, but the public needs to know that what was done at Chopper Tours was done well. They were in apartments. They had packages available to them. I congratulate you and everyone associated with it. It's not that we can't learn and do different things, but it's much better than having statistics that continue to show people dying in those encampments. When I was there for the closure of the encampment, one of the things that I saw that almost became a spectacle was the number of rats coming from tents into the streets. That's just not something that we should ever accept, no matter what the circumstances are, no matter what the issues are with regards to quote unquote housing or other issues. At the end of the day, people were dying in the encampments, and this is a way to reduce the number of people who are dying in those encampments. I appreciate your work.
Thank you.
You know, New Orleans is full of rats.
Yeah, but you should have seen the rats coming out of places where people were putting their heads.
Yeah.
Okay.
So, with that being said, Mandy,
Right, well, it's really, it's been a pleasure working with this team, and the note that I think we wanted to offer is a little bit of perspective from the work that's happening across the country and where New Orleans is fitting within that national work. And one of the things that I can say definitively is that the leadership that this city has shown on this issue is really the difference maker. And I think you've echoed it, you know, in all of your comments here today, but I think it is what makes this community unique and is positioning this community to do things that other communities are not, and struggling to find the leadership necessary to get to the same place. So I just want to appreciate that New Orleans in this case is pioneering for the rest of the country. You're demonstrating that you don't have to choose one citizen over the other. You can choose both. You can find a solution that's right by everyone in the community, and that it really is through the leadership of our elected officials and hiring really incredible individuals like Nate and Dr. Avegno and just the entire team here at the city that really makes the difference in how you move the needle on this particular issue. It's not going to be easy because these types of issues are never easy. And I think that everything that comes through that really becomes a model for the rest of the country is how New Orleans perseveres through that challenge and that adversity, and is willing to look at the nuance of these issues and take on, you know, the complexity and what it's going to take in these communities and in these neighborhoods in order to do right by everyone, right? The neighbors who are housed and the neighbors who are unhoused. So I just really want to appreciate that you're setting an example, you know, in this country right now. And it couldn't come at a more important time because the Supreme Court has been asked to take up a decision coming out of the Ninth Circuit Court of Appeals that will determine whether cities have the ability to enforce against homelessness without having to offer any alternative. And so the fact that you've embraced a model that demonstrates that we can do both, that we can house individuals and we can take back, right, our public spaces, and we can activate and support everyone in a housed orientation. It really is an important example in this particular moment.
Can I ask you a question? I mentioned the study years ago about recycling, right? And what I failed to mention was also the reports out of California encampments that talked about the number of diseases from diseases that they thought were actually grew within those encampments. How are we dealing with that? Especially, you know, I just went to the doctor. I had a cough that I had for 3 weeks. And then talking to my specialist, said there's about 11 or 12 different things going around right now. What consideration are we giving that, especially as it relates to its impact on the whole? You know, Mao Zedong used to say the good of the few shouldn't impact the good of the whole until he became the few, right? But that, especially health-related diseases and the way we're dealing with stuff right now, and I've even done some research that old diseases are actually making a comeback. Talk about, especially in a community as tight as ours.
Yeah, that's been a great concern. And that's why for the last 6+ years, we have done our public health cleaning, because we really do feel that has mitigated not only the harm and the spread to folks in encampments, but also to the larger community. I will say, you know, I'm not going to get up here and tell you that it was as robust as we wanted it to be. As you all know, because you've been on the emails, we are limited by the availability of NOPD and sanitation and our outreach partners. However, it has allowed us to identify folks that looked sick and help them get to care before they got sicker and before they could spread it to quite as many people. My team has also, with Healthcare for the Homeless, been working with both med schools to reinvigorate our street medicine team. So really being proactive and going out on a regular basis and identifying, even outside of the cleanings, folks who might need to be connected to services. It's been a challenge, but I think we on the whole have done better than a lot of our colleagues, particularly in California, because the scale there, just the sheer number of people in unsanitary conditions. I mean, it's really on the order of refugee camps. We've done a lot of vaccinations out in the unhoused population, flu, COVID, hepatitis A, anything we could do to mitigate, we've been trying to do, but really getting folks into housing is going to be the best thing to mitigate further spread.
Councilmember Green.
What about those, what is the plan? And if there's not, you can get back to us on to work with those who are so severely mentally challenged. And I've got to be careful with regards to the word. So anybody who's watching, don't send me an email saying that I used the wrong words. I think you know what I'm talking about. There are some people who don't want to be and will still not want to be housed because of whatever that condition, paranoid schizophrenia in general. I'm using too many words because I get tired of people then going to the media to say, look, they're insensitive. They're calling people different things. What is the plan for someone who is mentally challenged to the point where they cannot exist in an apartment alone?
So we've already started addressing that. And when I say we, myself, Dr. Vegno, we've already started looking into extended stays or what we call respite care for persons who are dealing with severe mentally illnesses. Those persons who are dealing with those mental illnesses might need an extended care stay or go to a place where a person specializes in that. So we're looking at what models work best for this community, and it's not going to be a cookie cutter model. We have to figure out how we can do so. And we've also asked for our state representatives to also plead on our behalf on state level, because it can't just be city resources, because this is not something that we can just handle locally. It has to be something that has to be indicative of the state stepping in and helping us with those long-term mental health cares, because we can't release those resources on our level. But I do believe that we have to pull all of these things together to be able to address that. Right now, we are unprepared for what that could look like. We are working on it best we possibly can by bringing the resources we do have, but if we don't hurry up and put something in place and put something in place soon, we will continue to fight that fight, and it will tire us.
So what would you be asking of the state that we as a city can help with? Of course, we even have a couple of state state officials or former state officials on the council, obviously resources, but it goes a little bit beyond resources. We're asking for long-term.
Yeah, anything that would expand the number of long-term mental health beds, which we have woefully inadequate number of. And so for those, what we can do on the local level, as Nate alluded to, we've already started, is intensive sort of case coordination. There are a handful of folks that are incredibly, have incredible mental illness that are on the street that everybody knows. Our partners at Metropolitan know them, health department knows them, Nate's team knows them, EMS knows them, everyone knows them. So what we're trying to do now is focus on them and within our own resources, how do we can we get them someplace to stabilize and try to work on a long-term plan? But so much of this is set at the state level, not only with reimbursement levels for behavioral health providers, they need to increase, and that's something that the state has control of, and then just increasing the number of beds for long-term inpatient psych stays, as well as options for 23-hour and other mental health stays to get folks off the streets and stabilized, whether it's for a few days or for several weeks to months. I will say that the State Department of Health has started to work on this. We've been working with them on Region 1. I think that that's going to continue under the new administration, which I'm happy to hear. But the more cases we can bring them that will highlight why we need expanded state investment in long-term behavioral health will be helpful.
So are you saying resources to facilities, private owned facilities that exist, or are you looking for more public facilities?
Well, that's the thing. If we're talking about folks that are Medicaid or uninsured, then it's generally state-run or, public facilities, and we do not nearly have the amount to support our state, much less our region.
What would you call those facilities, so we can use the right word? Psychiatric care facilities?
Long-term there's different models, and I'm certainly not the expert in there's a lot of specifics, but anything that would support for those most seriously mentally ill. Number one, making the bar not so high. The bar is incredibly high right now to qualify for a spot at a longer term behavioral health facility. And that's because there's such a shortage. So anything to expand beds would allow more people to avail themselves of those resources, particularly our Medicaid and uninsured population.
All right, we look forward to you letting us know what we as a council can do to work on a state level to maybe identify specific numbers or resources or do the cost benefit analysis type things that need to be done. But we certainly know that we have an issue on a state level where we want to help. Because if it increases the number of beds and provides resources for those who are, it's hard for them to be in a facility by themselves, we want to provide it.
Thank you.
Well, I think the governor's transition team on New Orleans is focusing on homelessness. And I've said to the people on that team that they need to advocate for additional state funding for mental health services. And I did receive an email right before coming down here from Janet Hayes, who's a big supporter and advocate for mental health services. And I say to her, and I say to anyone who wants to advocate, you need to look to the state. The city is doing all that we can, but we cannot provide the number of beds necessary and the services necessary to treat these acute mental cases. Am I incorrect in that?
No, correct.
Okay. I do have some questions before we get to public comment. Are there any other questions from any of the council members?
I do have a question after public comment.
Okay, perfect. Number one, Nate, I asked you this before, but I just want you to reiterate the issue that happens when people go onto private property. So for example, right now we have an encampment popping up on Arietta Kessel Haley Boulevard that actually I think we've discovered is state-owned property, but we can't get on it. So tell me what happens when people go on private property versus public property and what you can do and what the process is for even going on to private property.
We have to have the green light from the owner of the property for us to even try to do work on it. But being the person that's owner, and if they stabilize, then it's kind of like an eviction process. It becomes a really legal, long, lengthy process that we try to avoid at all costs. That's why when a person get onto public property, we can kind of work a lot more diligently and quickly because we have the right to do so. But they get on private property, it becomes really difficult to be able to initiate and to move the process in the right direction.
I mean, a lot of people who are on that private property will say, I have the right to be here. The owner says that I can be here. And then the owner, of course, can't be found. And then we have to go through a whole adjudication process
Right.
to be able to go onto that property.
Yes,
And we're seeing that in quite a few areas in District B,
absolutely.
specifically on Washington Avenue, on OC Haley and some other places as well. I see Matt Tory here from the Department of Sanitation. Matt, I know we talked about handing out trash bags and other things as a possible solution for people to bag their own trash, clean up after themselves. Is there any progress on that this Department of Sanitation could then collect?
Hey, good afternoon, council members. So I know we've deployed a good number of public litter cans throughout the encampments on North Claiborne and Calliope, and we're doing our daily collections there. And we're supporting Nate and Rachel and their teams as they are working through this decommissioning process to support, basically real-time collection of debris as it becomes available. So we're just walking that fine line balance of making sure that things we remove truly are debris versus personal property.
And has the ordinance that the council passed, that's, basically a scrap metal ordinance or dangerous item ordinance, has that helped your team at all address some of the objects that are just scattered about?
I would defer more to Nate, but I think probably yes, during the encampment cleanups. I think our challenge still is when folks are present and our teams are working, we just try to be very delicate about what we're doing
Sure.
and keep it purely to unattended items that are clearly trash. So we're not infringing on their space and certainly not mistakenly taking any of their personal property.
Okay, thank you, Matt. On, Lowberry,
Council member,
Can I-
may I just state one thing? I want to take an opportunity to just highlight what your Department of Sanitation has been doing in certain areas around Orleans Avenue, around Claiborne Avenue. When the encampments are done, I know it's a bit frustrating because we still have people dropping off and dumping furniture and dumping broken pieces of furniture. But your crews come out and they do a good job, and we see those results at St. Anne and Durbany, at Orleans and the down ramp on Claiborne Avenue and in other places. And I see that this week there'll be an encampment cleanup, because there are encampments throughout the city. I want everybody to know this, but an encampment cleanup at Almanasta in Florida. And those don't get mentioned enough. There's certainly never any media present for it, but I just want to say that the persons who work are doing a good job. And I appreciate the fact that the encampment cleanups are regular. What I do bemoan is the fact that people still come and bring things as if this is a good place to dump what they don't want, because these people who are marginalized already are the places that you should bring your urine-filled mattress to leave, as opposed to putting it out for the Department of Sanitation to take it. So the bottom line is I want to say thank you to the Sanitation Department for that, and also for the work that you're doing with regards to the cleanup of tires at Piety Street and Florida Avenue. You just cleaned up 1,000 tires. It's ridiculous that there were 1,000 tires there, but that, in addition to cleaning up at the encampment, doesn't get a lot of attention. But I see it, our council members see it, and we appreciate it. Thank you.
all right, one more question, low barrier shelter. So Nate, your team has taken over management of that. Where are we with the RFP? What's happening with that? And I will ask you yet again, do you have enough resources? Do you have enough people? What more can we give you to make sure that the low barrier shelter operates as it should and does not fall into decline?
Right now, the RFP is still active. We've had a couple of persons of interest, but nobody who has taken on it yet. I'm currently running it directly, and when it comes to resources, I am the resource right now that's running the low barrier shelter and also doing encampment decommissioning and some outreach and some other stuff.
And the competitive process closes February 16th.
Yeah.
There is deliberately a longer time period
Okay,
to give interested parties, but there's several interested parties that with a longer time period and some adjustments to the original proposal, we think are pretty gonna make an offer. So
all right, so February,
February 16th is when it closes, and then Tyra Johnson Brown, her shop is running it, and it'll be, I think there's a 2-week period for selection and to go through the process. So hopefully by end of February, we'll know, or close to there. Don't hold me to that.
But they did this morning, talking to Tyrone and team, said that there were 2 interested parties. One party had already gone in and started to do the application process and talking to board members. So I'm hopeful that, we can, solidify and get that squared away quickly. But right now, yes, we are in a good space. We've been working on cleaning up the location and getting persons comfortable. And we just came out of winter sheltering, and it was a success there. Tonight is first night of pit count. So we're assisting with that process as well. Unity, as our lead agency, is definitely made phone calls and gotten everybody ready for what this process will look like.
okay, and I said final question, but it's never a final question, and you should never trust the lawyer who says that. So the warming sensors.
Mhm.
I did get an email from somebody or online, whatever, saying that people were being turned away from the warming centers. Have you heard anything like that?
Yeah, and not to my knowledge. I do know that there was some difficulties getting to some of the locations because of restrictions. We have since then adjusted and made available more beds at our annex location. So that was taken care of. But some partners had ideas. We should have been a lot more clear within our process, but we're working on making sure that we clear those things up moving forward.
Okay, and then finally, I just want to point out to everyone in the audience, everyone who's watching, and our council members, that Nate, you've been here, you came here, what, last Mardi Gras,
Yes,
for not even a year.
no, not yet.
And we have done, I think you have done yeoman's work on really pulling this together. And I'm very appreciative of you.
Thank you so much. Thank you. I just have, your office has been a great help. King Green, thank you for all your support. Phone calls you guys take, evening phone calls. I do appreciate you picking up. Dr. Vegno, and OCD who just stepped in and helped out with our fabulous group of, Clutch Consulting. I mean, how could someone fail with all of those supports? So I appreciate all of you.
Well, we appreciate you. All right. Unless there's any other comment from the dais?
No, just thank you, Councilmember Harris, for, I don't think anybody could ever question, your heart or the fact that you try to bring everybody to the table. And I just want to make sure that this is an issue that's going to be solved by everybody. It's not just going to be one segment. So we have to be careful in our conversations, deliberate in our work, and intentional about how we want to come together to help this population. And thank you for your leadership.
I appreciate that. All right, let's go on to public comment. Just a reminder, 2 minutes per person, say your name, say your address, and again, I will keep you to that 2 minute period of time. So first is Peter Waring. And then as he's coming up, Martha from Unity.
Ladies and gentlemen, pleased to see you all. Thank you very much for everything that you do. My name is Peter Waring. I'm a retired architect here in the city of New Orleans. Eugene knows me well. He sold me my building that I practiced architecture out of for almost 30 years.
A long time before I became a council member.
A long time before I became.
Always have to say that to the
He did a
meeting.
great job.
3 days.
As my real estate guy. In addition to being a retired architect, I also have a master's in business administration. I've served on the board of Unity of Greater New Orleans for more than a decade now. I'm incredibly proud of the work that they do. And the rest of the team, other board members, other members of the executive committee are all extraordinary human beings, I think saints. Unity is a 32-year-old nonprofit coordinating the work of a collaborative of more than 50 nonprofit organizations to provide housing and services for those experiencing homelessness in Orleans and Jefferson parishes. On behalf of our member organizations, Unity oversees implementation of federal homeless continuum of care grants that can only be applied for by a collaborative, which we have. These grants require Unity to raise 25% matching funds. We are strictly non-political. We undergo a major federal audit every year and have a long history of clean audits. In 32 years, we have never had a single problematic audit finding brought against us ever. Not one. All financials are on the state legislative auditor's website. So I just wanted to make sure that the record was very clear. These are the finest people I've ever worked with. The reason that I have associated myself with them for so many years is because of their incredible integrity. And I would not have anything to do with them if they weren't the most amazingly detailed and careful people who not only carefully watch every penny, but they watch how every penny that's under their oversight is spent by others, and they hold them accountable. This is a great organization. I want to say thank you to Unity for everything that they've done for me personally in my life, in terms of being able to allow me to serve and to be of service in my retirement.
That's your time, sir. Thank you so much. I appreciate those words. Martha, followed by Paula Phelps.
Thank you, Peter. Thank you, council. I just want to say that we regard the city as one of our most important partners in the homeless continuum of care work, and we really appreciate the very significant and historic commitment that you have made to this work with your appropriation of the $2.5 million for housing and services to house people experiencing homelessness. I think that together with the new federal unsheltered homelessness grant is really positioning us, as Mandy said, to really, do something that very few communities will be able to do. And I do believe that we will be able to reduce homelessness to the lowest levels in 20 years, and with your continued commitment to sustain that. And that's very exciting to have such low levels of homelessness on the horizon. The good news is that after waiting for many, many months, we did just get our contract from the federal government for that unsheltered homelessness grant with the start date this month. So that's really good news. And that means that our subcontracting agencies, our member agencies are now have the authorization to begin to hire the staff to implement the housing and services. And I want to give a shout out to those agencies who stepped up to do this work, because it requires match, it requires, you don't get all your expenses paid. It really is sacrificial. You have to be really committed to do this work. And they are the Volunteers of America, START Corporation, NAMI, the National Alliance for Mental Illness, the Travelers Aid Society, Easter Seal Society, Jefferson Parish Community Development, Jefferson Parish Human Services Authority, and Ozanam Inn. So a shout out to them and to all of our partners who really made it possible for us to get a grant that was never intended for a community like New Orleans. The way that it was written by the federal government in the notice of funding opportunity, it really so heavily favored communities that had at least 1,000 people on the street that our chances of getting it were always very much an uphill battle. And it was really because, we absolutely slayed it on the leveraging from our partners, along with, just the track record of our continuum of care agencies and actually doing this work so well for so many years that we were able to get it. And I just want to give a shout out to all of the healthcare institutions who partnered with us, to the business community that partnered with us, to our housing authorities who really are doing tremendous work, providing resources for this grant, to philanthropies, particularly United Way and the Greater New Orleans Foundation and other foundations, individuals who stepped up.
Mark, I'm gonna have to ask you to wrap it up because I gotta
Yes.
keep everyone to 2 minutes.
So thank you to all, and thank you to our landlord community for your work as well. Thank you.
Thank you, Martha. Paula, followed by Casey. Paula? Paula? Pete?
Good morning, everyone. I'm really proud of what I'm seeing here today because I worked in the special needs community 30 years ago, bringing all these resources together for people who had no resources. And it's good to see. It's like a recycle of what I'm beginning to see, OCD and all those programs getting involved. It's a true collaboration. But I'm here to talk about the Housing Trust Fund because I saw that 17 million was going into multifamily housing. And I wanted to make sure that you understand that we need to improve the quality of life for our working poor families,
Yep.
especially those who work in the tourism industry, and creating home ownership.
Yep.
New Orleans is number 5 in the nation with the highest rate of Black home ownership, 49%. I'd like to see us become number 1. Unfortunately, we're tied with Atlanta, so we really need to move quickly. And I just want to make sure that there's more resources going into new construction because we don't have new construction in New Orleans. And while we're looking good at the state level, we lack 9,000 units of housing. We need to close that gap and make sure that production, home ownership, affordable housing for working poor families. And let's move on trying to get this poverty rate because we're number 2 in the nation with the highest poverty rate. And we have too many resources and too many tourists, too much taxpayers' money, and too many taxes for us who have to pay taxes. So just move our families out of poverty into creating generational wealth.
And Paul, if you don't mind, I want to highlight that, Madam Chairman.
Yeah.
When I recently participated in Congressional Black Caucus hearing, on wealth and home ownership.
Mhm.
You know, kudos to our Hispanic brothers and sisters, but they have exceeded us by 10%
Definitely, home
in
ownership.
home ownership as well
And
as
the
household.
Asian community too is
Well, the
16%.
Asian community right now is on
Yeah,
par with
everybody's
the white
exceeding
community.
us.
Right. And the history of New Orleans from Treme,
Mhm.
Oneida, Gentilly,
Right,
parts of Mid-City, we had the highest concentration of African-American home ownership
right.
of community. We have actually lost
We have,
ground, so that's extremely important.
definitely. Thank you so much.
Thank you, Ms. Pete Casey, followed by Judge Calvin Johnson.
Hi, Casey Davis, 5025 New York Circle. I want to say thank you, everybody, for being here and being attentive to this matter. When it came to my attention in August of 2022, a lot of what I was hearing was that there weren't many people out on the street, that there weren't many people paying attention. And now I'm seeing that it is all hands on deck. And I'm hoping that, you know, with the notes here, that we are paving an example for other cities. And I want to encourage that to go beyond New Orleans towards our neighboring cities that are sending individuals here. You know, you mentioned that some of them are not from here, which is true. You know, the word gets around that we house everybody. And from what I heard out on the street by the time Nate got here from August of 2022 and April of 2023, word had hit 26 states that we were taking up arms and taking care of this. So just to give the attention of what's going on in New Orleans, people are paying attention. And that's just word from the unsheltered individuals. That's not even the government's. So if we build something, it should be a blueprint that other cities can mimic, because we don't want them to keep sending everybody here for us to just handle a situation that we don't have enough housing for. So if we could set an example where everybody else can start building affordable housing across the nation, we're not going to face this problem over and over again, because there's how many, 200,000 or 100,000 in California? Thank you.
Thank you, Casey. Judge Johnson, followed by Donna Paramore.
Good afternoon, Council. I'm Calvin Johnson. I live in New Orleans, in case anybody wasn't sure. I am also a board member of Unity. I'm on the executive team. I'm vice president, actually, of the board of Unity. And just to echo some of what you've already heard, but one of the things is that we have to recognize our city. Our city is a leader, as you just heard, in doing what we're doing. And that is something as a collective we need to recognize. And we need to not only recognize it, but we need to applaud ourselves for it. The reason Unity got a $15 million grant from HUD that we didn't qualify for is because what Unity in this city has done since Katrina. That's what HUD looked at, and that's why HUD gave us $15 million. Now, along with that, they looked at the fact that this grant said, you got to hit $5 million of also promised care. That is entities that provide care will provide care directly to this population you're making house. Not only did we get $5 million of commitment, we got $15 million of commitment. This is how we were able to do this. But this is a testament to what this city is about. And we need to speak to it as a collective. This is something great that we are doing. However, the lady who just spoke is also correct. The rest of America is on some level sending us their population, not directly, but indirectly, because they are not providing.
In some cases, directly.
Oh, I agree with that too, but I'm just trying to be polite. But they're doing that too. And that's just true. And it is because we are doing what we are doing. And so let's applaud ourselves and not criticize ourselves because we haven't done it perfectly. Let's not do that. Let's recognize that because we do it so well, that is why we are capable and able to do it more of it than anywhere else is doing. That's a fact. That's an absolute
Yeah,
fact.
yeah, I'm, not that I feel I have to do that, but since we have reporters who are here, I think what we're hearing now is not for being critical, but as someone who understands the history of this community, and even this issue back 40 years plus, when I came back here in 1986 from the town I grew up in, that we've done well at addressing the problem. And New Orleans we've been on that roller coaster for 60 years when you talk about the social ills. We're a very good community at addressing issues. But where we've struggled is, how do we sustain it? How do we solve it? So, Judge Johnson is one of my idols, and I don't, there's no need here to correct him. But yeah, we've always done good at taking care of issues and taking care of problems. What we have not been good at is how do we solve it from one generation to the next, one political era to the next, and hopefully, given the work that I'm hearing right now, and given the working example that you've set, this time it's going to be sustainable, and this time we're going to have solutions.
But unless we, Councilmember, unless we in fact deal with the systemic issues that drives all of this, we're never going to solve it. You see, we're always going to have homelessness unless we deal with the systemic issues that drive people into homelessness.
And that's why I mentioned when you talk about homelessness, then many of the drive for the encampments is who's supplying the drugs.
Yeah.
Who's supplying the illegal activity. So that root cause, if we don't deal with that root cause, then we're not dealing with the cause of one of the primary issues here that deals with houselessness and homelessness. So if we're going to do it, let's be holistic. Let's not have the political blame. Let's not have somebody cares more than the other. But let's all of us say that we're committed to is not saying who's more for this or for that, but that every resource, every agency is saying, you know what, we want to end it, but not just end it for the next political regime, end it until the next depression or recession, but we want to make sure that as many people have a place to stay as possible. New Orleans is very good at problems. But when do the problems end? Let's end some of the problems.
Thank you, Judge.
Councilmember, I would just like to add to that, Judge Johnson. There are some people who will take a bit of issue with what you said. People who live across the street from encampments, where the encampments have been there for a decade, where people can't walk, where children can't walk on Claiborne Avenue because of the needles, where people can't have events, for example, or support businesses because there's no parking, because that parking was supposed to be for businesses. So now you have a lot of vacant businesses. I don't think that there has been as much negative criticism, even though I criticize the media. I criticize especially the Advocate, because I don't think they've ever talked to the people enough who are impacted by the encampments, and also those people who are even in the encampments. I'll tell you that I talked to them. Councilmember Thomas will tell you that he talked to them. When you say to get to the root problem, it is so complex. That's all I want to say, something that you know. It's drugs, it's alcohol addiction. It's also people who have been told to come here from other cities in Louisiana because they are going to get a house at the end of the day. We may go on forever, but we do have a responsibility to them. But I think that we're moving in the right direction. We have a homeless services and strategies office, and we have Clutch, and we have a newfound commitment. But I think that when there's criticism out there, we have to recognize that a lot of that criticism is very valid. If you live across the street in the 11 or 1200 block of Claiborne Avenue and you can't start your business, or you can't even rent your apartments out, they don't really want to hear how well the city of New Orleans is doing it. We failed them.
No question. No question. But of course, now we have an opportunity.
This is the opportunity.
We should have done a long time ago.
Judge,
We have an opportunity.
Judge, thank you for your leadership, and thank you for your leadership at Unity.
Okay.
And if you ever want to call me every morning and give me a pep talk, you can do that
Every
too.
morning.
Donna from Travelers Aid.
Good afternoon, Donna Paramore, Executive Director of Travelers Aid. I would like to say I'm grateful that the city had the vision for the Office of Homeless Services. I am confident in our partnership and how we are working together. As a result, we will see a great decrease in the number of homeless individuals on the street. But my question is, what happens once this initiative is over? I think as a city, we need to be proactive and have a plan in place to prevent homelessness. If not, we will be having these same conversations a few years from now. As a service provider, because of the funding that we receive, we can only typically work with individuals that are chronically homeless. And we get calls daily from individuals who are on the verge of homelessness. Those are individuals who are New Orleans citizens. Those are working single mothers who could not go to work for a week because their children were sick and now they can't make rent. So we need some type of plan in place that we would prevent homelessness. So sometimes we get temporary private funding where we're able to provide emergency rental assistance, but that doesn't last long. Last week, I had calls from mothers who were in the cold that I paid for personally so they could have hotel rooms, so they could be off the streets with their babies when we were having cold weather. So if we don't address things proactively as a city, we will continue to see these systemic issues repeat themselves over and over and over again. So I just implore you as a city elected officials, that we put some type of plan in place that would prevent homelessness going forward.
Thank you, Donna, and hopefully that's what the Housing Trust Fund will go to do. Carl Washington.
Can I add a comment?
Yes.
That's okay. So we have already started the sustainability planning meetings, and we want to continue those sustainability planning meetings so that we can create that plan so it will sustain after we have finished the decommissioning process. The plan will outlive everybody in this room and continue to be that plan that you spoke to about earlier, Councilman Thomas. That will be for the community permanently, not just 5, 10, 15 years, but forever. And it was done with the entire community. It won't be done just with us as OHSS, but with everybody who is a significant part of this community to make that happen.
Thank you, Mr. Fields. Mr. Washington?
Council members, how y'all doing?
Good, how are you?
Name Carl Washington. I am in New Orleans. Been a long time that I've been up here, but I've been awakened. So you all will be seeing me. Council member, when you say sustainability, that's critical. We have gotten a lot of money and a lot of people have come to the city with great ideas, great PowerPoints, get all this money. But then the problem, when the money goes, the problem goes away. So as a licensed social worker, I mean, I'm coming, like I said, I've been awakened. Give me a minute to catch up with the meat and potatoes of some of this stuff. You said that it's example for the nation. Has this model been tested and proven? Or this is a good PowerPoint with good ideas, or it's been tested and we can say this model actually works? So I'm hearing a lot of money. Money. And when it relates to caseworkers, you're gonna need caseworkers. You're dealing with mental illness, mental health facilities, drug addictions. You're dealing with a lot of illness to put people off the street into housing and to sustain that and to say you all have the model. We're gonna be waiting on that. We're gonna be looking, sir. We will be looking to see how it plays out. All this money, and you're talking about what's going on under the bridge, this been happening. I hope some of this money that y'all talking about is directed to some of the kids. What about the youth? You all factor in the youth in terms of how that's gonna be funded? Once again, I may not have the meat and potatoes, but I am engraved in this city and I know what's going on. You got a lot of people coming in this city getting money through the years, getting money. And the locals are suffering. The locals are not at the table. The locals are not involved. The locals are not benefiting. And then when the money goes, y'all goes. And then he says a model. So I'm not gonna take up much of y'all time. I'll be back. I will be back. I hope y'all do what y'all say y'all gonna do. And I hope the city council hold them accountable. Cause we had a lot of money come to the city, $8 billion. I ain't gonna go into no numbers. A lot of money have come to the city. And look where our youth are in recreation. Look where the streets, look where this and look where that, look where crime, but we doing well. It ain't adding up. So I hope you all mean what y'all say and do what you're supposed to do. And the people gonna be following the money. Cause that's all y'all talking about is money. And we ain't have seen no results yet. Thank y'all, Councilman.
Thank you, Mr. Washington. All right, so I have a card with no name on it. Anybody fill out a card and not put their name on it?
Any address?
Nothing,
No address?
nothing.
Come on, somebody. Okay.
And then I have a card that is from Mr. Green, but it is not germane to any topic. It says unacceptable and dangerous situation created by incomplete roadwork cleanup at intersection of East Bear Terrace and Briar Hall Drive that's affecting quality of life. That is not germane to any item on this agenda, so I would encourage you to reach out to your councilperson to discuss this issue. While we have a quorum, let's go ahead and I'm going to move to approve the minutes. Can I get a second? Seconded by Councilmember Thomas, all in favor?
Aye.
All right, and I will go ahead and move to adjourn unless there are any other comments.
No, I did mention that I wanted to comment after the.
Go ahead, Mr. Green.
And I just want to, just say, kind of in general, the work that you're doing is saving lives. I've said that already, but people are endangering themselves in those encampments and even in areas that aren't encampments by being outside in the cold. You know, it's challenging. I hear rumors that somebody was very, beset with some problems this weekend. It was so cold, but then all of the shelters had availability. People have got to take advantage of those resources. Those who want to help those who are unhoused have got to recognize that the city is concerned, but that we certainly will tell you that we need some help sometimes reaching out to some of those people. If you know somebody there, tell them to take advantage of the resources that are available. But I look forward to an organized process where there can be a long-term continuum of care. Some of the questions that I continue to ask are unanswerable at this time. For example, what percentage of the people are transient? Who's doing the needle exchange? Who's keeping a record of things like that? But I just want to see the encampments closed and those people who are unhoused be put into apartments. And I will say, this is my last thing. On this past week, I want to commend the New Orleans Police Department. There was an encampment on a private piece of property on Ursuline Avenue. They waited until they had gotten in contact with the private owner, and it took a while. But once they got in contact with him, the quality of life officer, Lieutenant Augustin, was very polite, reached out to that private owner to make sure that he had no problems with having the encampment that was on his property moved. And then she went to those who are unhoused and spoke to them in the way that helped them to understand that they had to get off that property. And guess what happened? They moved. They found another place to go. That's all. I'll just conclude with that. Thank you.
Thank you, Mr. Green. I think we've moved to adjourn. Thank you all for presenting today. Thank you for all of the people who provide services and support. And please continue to watch this topic. Thank you.
Thank you.